There's a concept in dentistry of informed consent. And what that essentially means is before any invasive procedure is done, the patient needs to become an educated consumer in basic English. What that translates to in dentistry is that they need to be advised beforehand by the dentist of the foreseeable risks, the advantages or the benefits of doing the procedure, and any available alternatives that there might be. So it's ideal when that discussion is in combination with a written document that the patient signs, because this way, if the case ends up having a problem and it goes into litigation, the defense attorneys, we have something that we can go by, a written document that was signed at the time that the patient was obviously advised of what those risks, benefits, and alternatives were then. Of course, patients will come up with all sorts of excuses, as they do during litigation. They didn't have their reading glasses, they felt rushed, any number of things that they might say, but it's a signed document nonetheless, and it's very, very strong in front of a jury. So it's been historically the case in dentistry that written informed consent forms were usually used for the extraction of wisdom teeth and other procedures that were done near the nerve structures or near the sinus. With more and more implants being done, what I have seen is less and less consent forms for these surgical procedures which are clearly invasive. And the maxilla and the mandible have different risks, clearly, based upon the anatomy that's associated with them. So it's very important before any invasive procedure, certainly with implants, certainly with extractions, that conversation takes place, an interaction, doctor and patient, back and forth, all questions answered, but to help a potential defense attorney maximally have a written document that the patient signs so they can't get away with saying, I just didn't know that those risks existed.